Good morning, everyone. This is Karina Hill with the Florida Alcohol and Drug Abuse Association, and I want to welcome you to today's webinar entitled Youth Coalition's Toolbox, Strategies for Virtual Connection by and for Youth with Ashley Gonsler. This webinar is being made available through a collaboration of the Florida Department of Children and Families Office of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that you are in listen-only mode and will only be able to view your name. If you have questions, please make sure you send them to the host and the presenter and place your questions in the chat panel only rather than the Q&A panel. Again, please post your questions in the chat panel to the host and presenter, and the presenter will address your questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and those options were posted in your chat panel. And if you miss those instructions, please just send me a message and I'll be happy to help you. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. However, you must be connected to the audio of this presentation and also be able to view it on screen to receive a certificate of attendance. Again, you have to be connected to audio and video to be able to receive a certificate of attendance. The recording and materials used in today's presentation will be available on our SPADA website within 30 days. However, the PowerPoint presentation is available now if you would like to go on the website and print that prior to us getting started. One helpful hint is the archived video displays what looks like to be an error message, but it's only a delay buffer. You want to ignore it, hit play, and enjoy. So to access the recording in PowerPoint, you would go to our Resource Center Training Library. SPADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign into your account to complete the evaluation. Information that you provide FADA as part of registering does remain confidential. Statements of credit will be posted within 30 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Again, you must attend the full webinar and complete the evaluation to receive CE credits and then to access your statement of credit. Do note that the evaluation will close at midnight on Friday, October the 23rd. 1 to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. However, if you do want your credits reported to CE Broker, you must include your licensed healthcare practitioner number so that we can report those to CE Broker. Please note that WebEx monitors your arrival and departure and provides a report upon completion of the event. So we are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. So again, we do monitor arrival and departure, and it is important that you attend the entire webinar to receive credit. We do not permit partial credit. And with that being said, I'd like to introduce our presenter, Ashley Gonsler. She leads a specialty coordinated care team comprised of clinicians, prescribers, peer mentors, education and employment specialists who collaborate to support transition age youth at Thresholds Emergency Adults Division in Chicago, Illinois. In this role, she engages in preventative work, crisis intervention, and uses a strengths-based approach to help youth, young adults, and their families with identifying tangible ways to break generational cycles and begin to create sustainable, healthy, and adaptive patterns. A graduate of Michigan State University, Ashley holds advanced training in cognitive behavioral therapy for psychosis, a best practice for treating individuals experiencing their first episode of psychosis, and is trained in the structured interview of psychosis risk syndrome to detect individuals at clinical high risk of developing psychosis. As CHR team leader, she is committed to identifying, providing preventative treatment to individuals most at risk of developing serious mental illness. And now I would like to welcome our presenter, Ashley. If you're ready, I'll go ahead and turn the presentation over to you.
Yes, thanks so much, Karina, for the introduction and for the Florida Alcohol and Drug Abuse Association and Florida Department of Children and Families, and also attendees. If anything, the pandemic has taught us is how valuable time is, and I am humbled that you all had chose to spend your morning learning about youth coalitions with me. So with that being said, let's start the presentation.
Are you having trouble, Ashley?
Yeah, I'm not seeing my PowerPoint show up.
Okay, let me try to transition that again. One moment. And
Okay.
thanks for your patience. Okay, do you see it now?
Yes. So as Karina said, I am a team leader at Thresholds in Chicago, Illinois. It's a social service agency, and I work specifically with a population known as emerging adults. So these are individuals who are coming into adulthood and learning what it means for them to be an adult and do the things that they want to do. So working with young people is something I'm really passionate about and has shaped my career. And this is why I'm really excited to share these materials with you all. Another important thing to note is my own experience working within a program in rural Michigan that essentially functioned as a coalition where we were working to expand services for individuals who weren't eligible for Medicaid but were in need of mental health services. So part of my job was to market this program and connect with community members such as clergy, primary care physicians, and local colleges in order to tell them about the program and get people in the program. There were some missteps within this attempt to do a coalition, and I'll tell you about some of. Yeah.
I'm sorry, I hear some noise in the background. I don't know if you're pressing up against something, but it's. You want to try to talk now?
Yes, 1 second. I think they're doing work outside of my apartment.
So, Ashley, I don't think it's work. I think it's some type of echo, like you're too close to your mic or something.
Okay, is it better now?
Yes.
Okay, sorry about that. One of the perks of working from home is adapting to the different technological difficulties. So in my role working with the coalition in Michigan, I'll reflect later on some of the strengths that it had and also some of the shortcomings that we encountered. So our learning objectives for today, we're going to start with defining what youth coalitions are and why it can support substance use prevention. Then we'll work through digital resources for youth with an availability of a resource page that you all are encouraged to use within the work that you do. And then finally, we will discuss how to use these toolboxes from a prevention standpoint. Now I'd like you all to take a moment to respond to this question in the chat box. So during your youth, who did you look to for validation, praise? Have a moment to reflect on when you were a youth, or if you still are a youth, who is it that you go to seek validation, get praise, or learn about different information about things?
And it looks like we have a lot of responses about family members and teachers, parents, grandparents, dance advisors, but mostly family.
Yes, lots of family members, mentors, school nurse too. These are great. And I think it's helpful for us to consider like our own experience as a youth and where is it that we would lean to for support, so then we can use our own information to better connect with youth that we're working with. So yeah, some youth leaders, group mentor, definitely family is a big theme, and then some friends as well. So awesome. Thank you all for sharing. So now I'd like to focus on why this presentation and in general is by youth and for youth. So thinking about youth-led and youth-created toolbox, let's compare that to a sports team for a moment. So when you're in the game, in the moment, let's say the buzzer is counting down and there's a game-winning shot to be had. You have your teammates who you rely on in that moment to make the decision of what you're going to do next, because they're right there in the game with you and they're dependent on you and your decision to pass the ball, take the shot, or do something else. You may hear the noise of people in the crowd, or you may choose to listen to your coach because maybe they have experience of having played the game. But in the moment, you rely on those who are alongside with you. There's a certain level of cohesion, trust, and reliance in each other that creates a space for youth to lean on each other. Youth are very moment-focused and peer-focused. So this is really important to remember. Who their peer group is defined by the situation. So within a family, it could be siblings, it could be cousins. In the game, it could be teammates. In school, it can be other students. So they're going to look at their peers for both guidance and focus. So why does this all matter? So although there are exceptions, most risk and protective factors associated with substance use also predict other problems affecting youth. So I'm going to talk about protective factors, and in a few moments, we'll then discuss risk factors. So as a lot of you know, protective factors are those that directly decrease the likelihood of substance use and behavioral health problems or reduce the impact of risk factors on behavioral health problems. According to National Center for Biotechnology Information, family, school, and community are protective factors for young adults when it comes to substance use. Some of these protective factors include opportunities for positive social involvement, recognition for positive behavior, bonding, marriage or committed relationship, and healthy beliefs and standards for behavior. Again, think about who you identified in the chat a few moments ago. Consider where these protective factors mostly present themselves: during school, relationships with peers, extracurricular activities such as youth groups that I've heard about. Now we're going to move forward to those risk factors. So from the same resource, the National Center for Biotechnology Information, risk factors include themes that entail individual, peer, family, school, and community. Some of these are early initiation of substance use, peer substance use, family conflict, which can include abuse and neglect, academic failure beginning in late elementary school, high availability of substances, media portrayal of alcohol use, low socioeconomic status based on education, income, and occupation, and low neighborhood attachment, meaning a low level of bonding to the neighborhood. So when we're thinking about trying to decrease the likelihood of youth to misuse substances, there are also other issues that come up that we can work to decrease in how we approach our preventative standpoint with youth. So some of these other problems include delinquency, violence, school dropout, and psychiatric conditions. So again, these are the risk factors that increase the likelihood of beginning substance use, of regular and harmful use, and of other behavioral health problems associated with youth. The programs and policies we're using to address these risk factors, and they also have the potential to also prevent some of these other issues that impact youth as well. Okay, so I'd like for you all to take a minute and pause and think about what part of your life or someone you know that's been impacted by the pandemic. Yes, I see work coming up from Allie, myself and family. Socialization is a big one. We're going to get into that too. Not having visitors, worry about family members, different staff. We have church impacted, work impacted, not being able to see loved ones, mental health, kids, leisure activities and grocery shopping. Lots of different losses in different ways that impact us directly and the people closest to us. And I'm noticing a lot of people in responding to this question, it's similar about the person they look to for support as a youth. Yeah, so thank you all for responding. Some of the common themes have to do with that isolation, mental wellness, employment, working from home, lots of that social contact and doing things that we really enjoy doing. And then for those of you that are parents, having that stressor and having to manage helping your kids learn in a much different way than anticipated. And a lot of loss of those extra supports that we use, whether it's church, hanging out with friends, seeing parents, or financial support too. Thank you all for responding to that. So according to the Mayo Clinic, some ways in which the pandemic may impact someone's life includes altering daily routines, which I saw a lot of those, how our whole routine and what we're used to have completely changed. Financial pressures, social isolation, worry about the future, stress, anxiety, sadness, loneliness, and mental health disorders can worsen. So since this specific training has a component around digitally connecting youth to each other to implement prevention, we must consider how this pandemic has impacted youth access to protective factors and what new risk factors may be appearing or increasing. And if you recall a few slides back, some of the risk factors include family conflict, such as abuse and neglect. And so with people staying at home, stressors can get higher and more likely to have a negative impact on already difficult situations or relationships where someone might be experiencing abuse or neglect. So the Recovery Village recently surveyed American adults, so age 18 and up, about their past month use of drugs and alcohol to better understand how the COVID-19 pandemic is currently affecting substance use and mental health. So as a note for this one, some of the questions asked respondents to select each option that applies. So in a few instances, the total percentage will be greater than 100. So this is a really great interactive resource where you can pick on a specific state that you want to look at. So because this presentation is geared towards Florida providers, I selected Florida. So in this survey, the participants were asked why they were prompted to use substances within the last month. So as you can see, the highest increase was related to stress. After that was boredom, and then related to anxiety and depression. Others also reported recreational purposes to treat pain, or that it was part of a daily routine, such as having a drink with dinner. So the reason that I wanted to focus on this within the context of substance use in the pandemic is that more than half of the people are reporting more substance use. Also, that the top reasons for people using more include a lot of the things that were listed in the chat. We have stress, we have depression, we have anxiety. So this is important to consider when we're working with youth and trying to figure out how they are impacted by this pandemic. So in January 2020, Australians took part in a poll by the YouGov Galaxy for the Foundation for Alcohol Research and Education. Each year, the results of this poll shed light on Australia's drinking habits and attitudes toward alcohol. In this year's poll, the findings show that even before COVID-19 lockdown restrictions were introduced, Australians were drinking more at home than in previous years. Of those polled, 73% said they drink most frequently in the home, compared to 15% in pubs, bars, or clubs. In addition, 67% said their heaviest drinking occasion was in the home. So it makes a lot of sense why people are going to drink at home. So it's important that while we continue to be in a pandemic and have so many restrictions on our ability to go out and socialize, that we create these virtual toolboxes so people can access supports and increase those protective factors. Because in this pandemic, someone's home can both be a place of risk and it can also be a protective factor. And it's our job as providers, peers, teachers, nurses to pull out those protective factors and decrease the risk factors. So let's transition into the part of the presentation about why coalitions are an effective way to engage youth. So coalitions are more than just a group of people meeting to work on stuff. So I want to chat about the experience I had in Michigan around a program where we were actively trying to increase engagement within this new program that provided mental health services for individuals who didn't qualify for Medicaid but clearly had mental health and substance use needs that could be addressed with treatment. So I remember that I was told to go ahead and partner with community members in order to try to get more people engaged and involved in participating in our programs. So thinking about the context, I'm in a rural part of Michigan. There's a lot of poverty, unemployment, substance use, and I'm supposed to go out there, not being from the community, and try to pull people into participating in our new program, talking about mental wellness and addressing substance use and mental health factors that come up. So as an outsider, starting from the bottom, trying to learn more about who I should connect with, some of the people were the easiest option. I'll just go to a primary care physician. But a lot of people don't have insurance or they don't have the means to have medical appointments and physicals. So then I'm missing some people in doing that. So then I'll move on to local colleges and I'll partner with their wellness center, which gives me some people, but also a lot of people who aren't even from that community, but are rather just attending school there. Okay, then I'll next go to the clergy because there's a lot of churches in this area where I'm at trying to increase participation in these services. Well, that was great. And even one of the pastors I met was also a therapist. So that was helpful. But what was truly missing is there was no engagement with the people who could benefit from our services, asking them why it was that they might agree to participate. So one of the missteps I noticed was that there was no focus group or community gathering in order to bring people in to hear their ideas and learn about what it was they would need within the community to feel more supported by a service, a community mental health agency that they might be reluctant to engage in, might not know a whole lot about. And so that was the biggest misstep that I recall from my work in trying to get this new program up and running. So if I would have done things differently and really started to connect with the people within the community and use them as resources to launch this program, I may have gotten quite a bit more traction of people coming in and people benefiting from it, because it's really hard for someone who's not from this community, this rural community, to come in and say, here's what it is people from this community need. It really needs to come from within the community. So switching gears, I'd like to talk about a program with my current job that I feel is close to being like a coalition in a lot of ways, though it's not necessarily a coalition. So within Thresholds, we have our youth and young adult programs. And within the last year and a half, they've started a youth advisory board. And that is compiled of individuals who receive programs within our young adult division. So this is not a coalition in the sense of There's not the one main goal of, let's say, preventing substance use within the community, but rather to try to elicit feedback from individuals who participate in our programs in order to shape our services so that they are more helpful and more effective for the youth that we serve. So one of the things I really enjoy about the Youth Advisory Board is meetings are run by youth. Youth present ideas. If there's an idea to have a certain event, youth are able to create the materials such as flyers to send it out, decide how to pass it out, what they would want at the event, what's the outcome for the event. Youth also talk about what it is that they'd like to look differently within their programs, and then chat about how they would go about doing that, whether it's interacting with the board of directors for our agency as a whole, whether it's doing some policy work in our capital in Springfield, Illinois. So this is a really empowering opportunity for individuals to participate in, and I've seen some of my own clients be a part of this and really grow in their leadership and their advocacy, and really being able to name the things that are helpful and things that would make our program even better with serving the youth that we do. So it's important to note that as we're talking about this level of youth engagement, like it's natural for us as adults to start to feel uncomfortable, and that's what we need to work through. We need to be able to surrender some control, power, and our own comfort in order to open the doors for youth to be a voice and name what it is that they need and want when it comes to services. One of the worst things we can do as providers is to ask youth their opinion and then not follow through or do what they ask, because that breaks their trust. So we need to work on sitting in our own discomfort in order to give that power and control to youth. It's a really important context of being able to have things that are by youth and for youth, we're not just saying that we really want youth to be the leaders and then we help with the background pieces, but their voice needs to matter, and we need to relinquish our control in order for them to have that sense of power and control. Okay, so Karina's going to help me out here in doing a poll. True or false? A coalition's purpose is to comprehensively look at the environment, seeking to achieve population level changes to the entire community. So we'll give about a minute and then we'll close the polls out.
Okay, we still have a few who haven't responded, so we're going to give you about 15 more seconds. Thank you.
Okay, so it looks like based on the poll responses, A majority said true, some no answers, and a few said false. So this is true. A coalition's purpose is to comprehensively look at the environment, seeking to achieve population-level changes to the entire community. So we all know the word coalition and may have some ideas of what that means, but my goal is to provide more specific information about what that can look like in the roles that we have. So most approaches focus on addressing individuals or specific components of the environment. So this could be the example of teens who learn about substance use prevention in classes at school are limited to students in those classes. So anyone remember taking those DARE classes, but let's say if someone was absent when they happened, they would miss on that opportunity. So there's a lot of error for people to not participate in those. So by contrast, coalitions focus more on the availability of the substance in the entire community environment. So as we continue to think about coalitions, we have to work on how to balance involving youth and their ideas while also reining it in when there might be things that are difficult, if not impossible, to implement, but also thinking about how do we work to join and engage with youth to gain their trust and to involve them, because think about it, there might not be a lot of buy-in for youth joining a community group for substance use. They might think there's judgment or it's a trap and they might get in trouble if they really talk about their substance use. So really, as we're talking about coalitions, it's really important that we focus on engagement. And with my role right now and with the pandemic, it's made our team and our program a lot stronger at being creative of engaging youth during a pandemic. When things are hard, it's tough, and we're asking people to meet with us to talk about hard and vulnerable things. The same thing with this idea of a coalition. Think about it in a small town or rural community, or a community where there's a lot of judgment around substance use. We really need to work on engaging youth by being authentic, being transparent, and being intentional about engaging them for the purpose of relinquishing our power or control and ensuring that youth feel and know that this is something that we actively want them to share with us because their voice matters and it is truly important. The Drug-Free Community Support Program, in 1997, Congress enacted this Drug-Free Community Support Program to provide grants to community-based coalitions to serve as catalysts for multi-sector participation to reduce local substance use problems. So we're going to talk about the main goals of coalitions. So 2018, by that time, nearly 2,000 local coalitions received funding to work on two main goals. So goal number one, establish and strengthen collaboration among communities, private nonprofit agencies, and federal, state, local, and tribal governments to support the efforts of community coalitions to prevent and reduce substance use among youth. So goal number two, reduce substance use among youth and over time among adults by addressing the factors in a community that increase the risk of substance use and promoting the factors that minimize the risk of substance use. So thinking about my example in Michigan and trying to get people's buy-in, really what we were truly lacking is having the people served being involved. And this is incredibly important. This is important in order to not just help reduce the risk of substance use among youth, but as you see, in order to have that impact over time, impact adults and within the greater community as a whole. Okay, so now we're going to transition to this other idea of how to address substance use within a community, but this is the public health approach. So the public health approach demonstrates that problems can arise when a host, such as the individual or person using substances, interacts with an agent, so the substance like alcohol or drugs, in an environment. So the social and physical context in which substance use does or does not occur. So it's important to consider how this public health approach differs from a community coalition. The public health approach is focused on an individual using a substance deemed as problematic or a problem to be fixed. So thinking about someone who's been mandated for substance use treatment or might be on probation or parole, or someone that encountered some reason at their work for them to require substance use treatment, is more focused on that individual and changing that individual's use with substances. So the coalition takes a step back and examines the other contributing factors within the environment, the community, and overarching risk and protective factors. So we're going to talk a little bit more about that on the next slide, but really thinking of this idea of what substance use treatment or treatment in general has been viewed as from the public health approach and how it differs from what we're talking about when we're talking about youth coalitions. So the public health approach can have effective efforts focusing on the specific situation or individual or families to be fixed or helped by the means of a treatment center or facility or outpatient center, whereas the coalition uses those other things that the community already has that have to do with faith or religion, schools, groups like extracurricular activities, to not only address what is happening at the present moment, but to also prevent for the future and reduce the likelihood of the issues increasing. So this is a multi-strategy approach, and it's thinking about what communities already have from, let's say, a strengths-based perspective. We're trying to build off of what a community comes with, as opposed to naming what it is the community needs and then us creating the space for people to come to. We're really integrating and aligning with the community in order to create this coalition relationship. So community coalitions do use the public health approach to identify the sources and availability of the substances and to explore use or trends. However, the difference is how a coalition addresses it. So one of the main things they do differently is how they partner with communities rather than acting upon communities. Community members and resources become part of the coalition and are agents of change. In this manner, coalitions are very strengths-based in identifying the strengths that exist and finding ways to partner with the community. So I think back about the approaches within the community that were taken at my last job and the advisory board at this job, and it's a major difference in this partnership and bringing out those strengths and resources that are already embedded in the community can have all the impact in making the difference of what it is that's going to be happening, not just in that moment, but also long term. So now is a good time for us to take a 5-minute break. And then when we come back, we'll dive into some digital resources for youth. Anyone who might have some questions, feel free to put it in the chat to host, presenter, or all panelists, and we'll have time to check in about those before diving into those digital resources for youth. But Karina, if you'd like to put up the intermission slide, we'll take 5 minutes and then come back together.
So we want to welcome everybody back from break, and we'd like to open up the floor with any questions. So if you have any questions or comments, please put those in the chat panel to the host and presenter or all panelists. Thank you. Okay, so we have a comment or a question here. One of the problems coalitions focused on prevention face is how to measure their effectiveness and specific outcomes. Has there been any progress made in developing tools or strategies that improve correlation between implementing prevention strategies and measuring results?
Thank you for that question. That's a really great question. And as we dive into some of the resources, there are specific information about different coalitions that are using preventative approaches and what the outcomes are. But I do think that is something that is certainly an area that could be more focused on how to really be able to see what the impact is long term. So great question. We have some resources, but if anyone else wants to chime in with any other thoughts to that, otherwise I'll wait till we get into showing the resource about places that are using coalition.
If you have any questions, please post them now before we move on. Thank you. Okay, Ashley, it looks like we have a quiet group and you're covering a lot of information, so maybe you're already answering their questions, but if you're ready to get started back on your presentation, go right ahead.
Sure, thanks, Karina. And as stated before, if questions or comments come up, feel free to continue to put them in the chat and Karina will alert me when they are there. And now we can go ahead and transition to the part of the presentation where we're focusing on digital resources for youth. So again, reinforcing this idea of during this pandemic, all of us have noted different ways in which we've been impacted, and thinking about youth being at home, not returning to school, especially for their senior year, and missing out on different things. It's incredibly important for us to feel prepared with different resources that are available for youth to be able to utilize. So some folks may be familiar with SMART recovery model, but as I was compiling this presentation together, I was informed that not a lot of people know that they have team-specific resources online, and they have different meetings too. So I'll go ahead and talk a little bit about SMART recovery for anyone who might not be as familiar with it, and then we'll go ahead and hop on their website so I can show you some of the resources that they have. So SMART stands for Self-Management and Recovery Training. SMART Recovery is a nationwide nonprofit organization that offers free support groups to individuals who desire to gain independence from any type of addictive behavior. SMART Recovery also offers a free internet message board, discussion group, and sells publications related to recovery from addictive behavior. So the message board discussions, that's a place where young people can discuss issues related to recovery and share ideas and strategies for things like peer pressure, dealing with urges, and managing upsets. It provides a safe environment for both peer support and guidance from experienced and trained volunteers. So for the online teen and youth meetings, Smart Recovery meetings are practical, open discussion forums where youth can ask questions, bring up topics, and learn real-world applications for SMART tools. The meetings are facilitated by experienced and compassionate volunteers who help guide discussion while providing a safe and welcoming environment for youth to work on recovery. You need to sign up for the message board to get access to the online meetings. So I'm going to go ahead and share my screen so we can explore the website together. So then as you all go back to your work and life after this, you'll have an idea of how you might present this to youth who might benefit from this online resource. Just bear with me 1 minute while I get the sharing underway.
Are you okay, Ashley?
Yes. Let's see if this comes up. Let's give it a moment.
Yep, we're seeing it.
Okay. Let me exit this one. And then, so this is the Smart Recovery main website. This one's specifically for teen and youth. So as I was looking at this website, this really feels approachable, easy to digest, not a lot of long paragraphs, but really lays out what Smart Recovery looks like. And then gives a little bit of information about how they utilize this approach with managing addictive behaviors. So I like also about this program that there's a lot of peer support, and it emphasizes, as we see here, that youth are in control. I think that's something that sometimes is hard when we're trying to support individuals doing high-risk behaviors, is to really reinforce this idea that they do have the control and ability to make choices for themselves. So as we scroll down to the resources, here's the message board discussion groups that I was talking about that you need to sign up for in order to have access to those online meetings. So one idea is, like, if you're working with someone and trying to see if they have buy-in to doing anything like this, like an online meeting, it might be helpful to pull this up and go through it just as I'm doing with you all and actually sign up together if that's something they agree to. Or if they want to wait, then you can always wait till the next time you see them and see if they're willing to sign up. And then here's the information about the meetings. There's a handbook, and there's also some other resources. So we're going to dive into the SMART tool chest, which I already have pulled up. Okay, so what I like about this resource is that it has different approaches that can speak to different youth. So some people like the idea of having a worksheet, something tangible they can write on, they can reference back to. I've had youth where I've brought in a worksheet and they're like, am I in school? What's going on? So I think it's really important to know who it is you're working with and ask them their preference. If they would like to do something like a worksheet here, you're able to print it off and do it together. There's some values work, some change plans, all helpful resources that you could potentially use with youth. And then there's also videos too. So thinking about knowing the person we're working with and being able to know if there's someone who learns by visual or audio learning, like these might be the best way to approach some information as opposed to presenting a sheet of paper and talking through it. So again, really important to check in and know the approach that works best for them, and then being able to work alongside them through this process too. There's also some information here for professionals, whatever that means. I think that means us providing support to individuals, different coping statements, disruptions, relapse prevention, additional homework. Again, homework could be something maybe you might not want to say, especially with this online schooling, but just an idea of all of the resources here available that are specifically geared towards teens can be really useful. So I'm going to go ahead and stop sharing the screen, and then we're going to pop back onto the presentation. Okay, so now we're going to talk about another resource. So this is the Society for Adolescent Health and Medicine. So specifically resources for adolescents. So adolescents and young adults, that's who it's for, but also healthcare providers and youth serving professionals. I really like how they worded that, youth serving professionals. What it is, youth-friendly substance use online resources. So this includes support groups, peer networks, helplines, treatment locators, and advocacy opportunities. So again, this idea of using peers and peer networks. On my team right now, I have a peer mentor, and I can just say how much of an impact that she has had on our clients and how willing clients are able to talk to her about their substance use, some risky behaviors or things that maybe they haven't felt comfortable sharing with the clinician on the team or the prescriber. So peers are really great assets to the work that we do. So the link is on this page if you'd like to reference it. And then also slide 35 is my resource page. So that can be something after this PowerPoint presentation you keep, you add as one of your favorites on your web pages, just using this as a way to build up your own toolboxes that can be used to support youth specifically. Okay, so Youth Providers 2.0 initiative. This is substance use resources for youth. It's a one-page that includes youth-friendly substance use online resources. It shows substance use resource institutions, links to treatment providers, support groups, and helplines. So this one-sheet reference, I think, is really helpful for youth and or their families to have like a quick synopsis of different opportunities that they have to connect with others, to find their own provider, or just to be aware of different resources. Because I think sometimes if we give so many different options or like a whole booklet on it, maybe it won't stick. Maybe it'll just feel too overwhelming. And I think we've all had that experience of like going to the doctor and being told all these different terms and these different treatment options. And we're like, I'm not sure what's even going on. Can you slow it down and explain it to me? So I think this one is a good sheet to have maybe in your office or in your backpack if you're a community worker. And it's really important, again, for youth to have access to transparent information, because going back to that team example, most youth teach each other, but may not always have accurate information. So young people can't make healthy decisions about their substance use if they don't receive transparent information. So it's why it's really important to have these resources and share with young people, because teens are curious about it. And any youth that go to these websites are seeking information on how to make healthy decisions about substance use. So really, if we're thinking about how we want to present this information, we want youth to see it as non-judgmental, approachable, and they're there to learn. And then those are the individuals who will have the impact on other people, because then they tell their friend that, they tell their cousin, their teammate, and that's how we have youth create this ripple effect for how to make healthy decisions about their substance use. Okay, so this is another one where I'm going to go ahead and share my screen, so bear with me just a moment. I'm hoping this one will go a little quicker. Let's see. And I don't know about you all if you're doing any telehealth or what have you, but I know several times I've just had to laugh when there's been a technology issue and I'm mid-session with an individual. They've been really understanding, but it's something that you're really just having to roll with and kind of just deal with, knowing that it's going to happen. So this resource is called Youth Move National Peer Resources for COVID-19 and social distancing. So this is where the different Youth Move chapters are invited to contribute the resources you have found to be supportive in this time of coronavirus and required social distancing. Together, we can care for each other. So as I go over these, there's different layouts and how the information is presented as far as like what someone might be searching for when it comes to resources. So pay attention and please note in the chat box if there are specific ones that stand out to you as ones you have used or another resource or one you're interested in using. So thinking about my own team, we had our peer mentor help support and also creating a list of resources. And one of the really important things to keep in mind is economic and accessibility concerns. So when we're putting together a list, we don't want to create more barriers for support. We really want people to be able to access these things. And if they have troubles, help them problem solve if there are ways for them to have access to these or create their own sort of support with it. So we have a lot of young adults that are into different gaming. There's the art one that shows a lot of the Google designs that come up and sometimes have games. That could be a really good mindfulness activity for health. I want to highlight Yoga with Adrian and share a personal story with this. So I have a sister that lives in New Hampshire, and we don't have a lot of like shared hobbies or activities. And with the pandemic, we've connected so much more just by checking in and doing video calls. And so we had decided to do some yoga together in order to reduce our own stress and feel more connected to each other. And then each week we do a check-in and talk about the 2 yoga practices that we did or attempted to do that week. So the Yoga with Adrian, it has all these free resources that are on YouTube, that are on our website, that have different calendars that have these free videos to do. But oh my goodness, there are some that really just stand out to me and help me feel completely relaxed without judging myself too harshly on not being able to do these tremendous roles of the different positions that yoga requires. She has a very soothing voice, and it's something that helps ground me when I have a busy day at work. So in thinking about application to our jobs, maybe let's say if a youth is expressing interest in trying yoga, it might be a cool idea to go through and pick out an exercise and ask them to do it before the next session. And then you guys talk about your experience, kind of like how my sister and I do. Talk about what was challenging, what they liked about it, and really being able to pick out another activity for them to try on their own, because there's ones related to anxiety, stress, different pains, like back pain and that sort of thing. And I think that this could be really helpful, again, for youth to feel connected. Or maybe if someone wants to feel connected to a parent or a cousin or someone else, maybe seeing if they'd be open to that task of doing this activity with someone else and then being able to parse through their experience together to feel that connection and also teaching a really helpful skill. All right, so we all are familiar with TED Talks. That's a good one. Virtual museums, and then to stay socially connected. I know Reddit's the big one. There are specific ones for individuals in recovery, and there's one about wanting to stop drinking alcohol. I don't know if we want to recommend Zoom if any of you are experiencing that Zoom fatigue, but that's something. And then responsible news sources. So again, especially right now in the world with politics, social justice issues, things happening in the world, it might be helpful to talk to a youth about where to get helpful news resources where they can get accurate information. Places of positivity, so if you're doing any self-esteem work, wanting to help improve someone's self-talk, there's some good resources here. And then I know, going back to the chat, we could all use some reducing anxiety. So NPR has one. There's ones for trails and maps that it's really cool. Journaling options. I know Calm I use a lot. Headspace is really big. And also, too, for youth who might be more inclined to listen to athletes or celebrities, I know that LeBron James has a connection to, I think it's Calm. It might be Headspace. I'm pretty sure it's Calm, though. So again, that's like helping to break a barrier about why someone might be like, well, I don't need an app to tell me how to relax and that sort of thing. This is a really cool way to do it because they have different celebrities and well-known athletes talk through their own experience of how they use things such as meditation in order to reinforce their mental wellness and how that helps them in the game or on the stage. Stop Briefing is one I've also used too. There's the quarantine chat, and then Places for Learning. So this one's kind of cool to maybe suggest to a family who might be bored and want to see a zoo or aquarium. There's live feeds of different ones, so that can be a bonding activity. Podcast, Unlocking Us with Brene Brown, really good one. Other museums here. And then there's financial resources. So for accessibility reasons, individuals, I know with school or in general, seeing what their access to internet is. So then we're not giving them a list of things to do online if they don't have the capacity to access it, but rather helping to break down barriers. And then to online support groups, Warm Lines, Trevor Space, and then support and recovery for youth and young adults, food programs, and then ways to volunteer, Spanish language resources. So again, this is something that might be a good thing to go through with an individual, see what they're interested in, and being able to follow up on it, because that's what a lot of success in my engagement with youth during this time is, to really find out what they're doing, how they're spending their time. If it's a TV series, sometimes I'll watch it so then I can talk to them about it. Or if it's music or a podcast, really it's about connecting. So then we feel like we're in this together, even if we might not see each other face to face as we used to do. All right, so I'm going to go ahead and stop sharing the screen and then take a peek at the chat box, because I know some of you have been saying what they've been using. Oh, that's awesome. Someone else loves Yoga with Adrienne. We have Songmaker, some TED Talks, Headspace, All Trails. Very cool. All right. So yeah, so this is just a fun, approachable way to bring up more supports and resources to go through together with a youth or to follow up on. Oh, I was right. The Calm app is with LeBron James. Yes. And I know, too, there's some that do, like, stories at night or something with different narrators, too. So something to think of for yourself, for the people you serve, just as a way to continue with engagement efforts. All right. And now we are going to go back to the slideshow and focus on Rural Health Information Hub, so a community coalition prevention model. So this one is focused on strengthening the collaboration between public and private organizations and communities to address factors in the community that increase the risk of substance misuse and support interventions that promote environmental strategies to address substance use disorders in the community. Now I'm reflecting, I should have kept sharing my screen because this is the one where it talks about different places already practicing coalitions. And so let me pull that up again so we can kind of chat through this example, and feel free to continue adding any additional resources that weren't in that resource guide, but you think could be helpful, so then we can all just share our information of things that youth are using in order to be connected.
So while you're doing that, I'll just read a couple of comments. Several people like the yoga with Adrienne. Someone commented that TED Talks can be very good, but they have a wide variety of talks from people with varied agendas. So some of them are not always promoting healthy solutions for youth and might be discouraging, so you want to review those ahead of time. Also, someone mentioned that their clients like Songmaker, Yoga with Adrienne, Congregate, TED Talks, Responsible News, Action for Happiness, Reducing Anxiety, Headspace, All Trails, Podcast, Museum, and Aquarium. Another person said, I love the Calm app. I use it every night. LeBron James is on there with 5 different meditations. And that's pretty much it. Keep your comments coming. Thank you.
Okay, so we're focusing right now on rural health, and I know I spoke earlier about my experience working within a rural community. If I'm not mistaken, a majority, if not all of you, are from Florida. And since I'm not super familiar about what areas are more rural, please feel free to add in the chat if you have experience working specifically in rural communities when it comes to substance use treatment and prevention. But what I thought I would do for this one is go through the community coalition-based prevention models. So I remember, I believe it was someone named Kevin had asked about like how effective this was and how to measure that. And so this is an example of different places that are using these models, and we'll kind of talk through what they're finding, but also feel free to reference this later as well. So to start off, we'll look at the examples of community coalition-based prevention models. So Prosper is one that is school-based, engages youth and families. So they're connected to local universities, and then they work to implement evidence-based practice programs, conduct need assessments, monitor implementation, and evaluate outcomes. Once teams are formed, they're charged with selecting the most appropriate universal family or school-based programs for youth and their families within the community. So Prosper has shown to reduce use of marijuana, methamphetamine, and inhalants, and lifetime prescription opioid misuse and prescription drug misuse. And Prosper has demonstrated a benefit to cost ratio of $1.63 in benefit per dollar spent and is listed in the Surgeon General's report on alcohol, drugs, and health as an evidence-based prevention program. So something to note is that each of these are going to reference a benefit to cost ratio, and thinking about your own agency, community, wherever you're connected to. If you leave this webinar feeling enthusiastic and motivated to try to implement a youth coalition, that's wonderful. And I would love to hear from you. But also, too, I think one of the things that would be important to note when you're trying to have buy-in from an agency, a board of directors, or a community that might be more focused on the public health approach is to point out the cost to benefit ratio and also provide specific examples of where these coalitions have had success and what that success has looked like. So bringing your evidence for it, but also too talking about the financial impact and how it can be beneficial. Okay, so Communities That Care is a universal coalition-based community prevention model created to prevent substance use disorders and other problem behaviors among youth. It's an ongoing process that's comprised of 5 phases. So identifying stakeholders, organizing work groups, developing a community profile, creating an action plan, and implementing and evaluating the action plan. The Washington State Institute for Public Policy found a benefit to cost ratio of $5.20 on Communities That Care program. The training materials are free of charge and available to download on the CTC website. This is also an intervention listed on the Surgeon General's report on alcohol, drugs, and health as an evidence-based prevention program. And then the last one to name is Project Northland. So it's a universal, multi-level intervention designed to delay the onset of alcohol use among students in grades 6 through 8th. The program focuses on different themes at different grade levels, with 6th grade focusing on home-based activities, 7th grade focusing on teacher-led curriculum, and 8th grade focusing on peer-led programs. Project Northland has demonstrated a benefit to cost ratio of $2.73 in benefit per dollar spent, and is listed again in the Surgeon General's report on alcohol, drugs, and health as an evidence-based prevention program. So then this online resource is really great if you're considering implementing a coalition, or if there is one and you're wanting to see what are things that have worked or not worked, and to get some more resources and ideas. Go ahead and check this one out. I mean, I could go through more, but I want to spend time on some other things. But this is another resource that could be really helpful to an agency, or if you're going to bring it back to where you're working, to go ahead and get some material from here that's available. Okay. Oh, I see there's some people from Michigan. Very cool. There's some Michiganders participating in this webinar. Okay, so we're going to dive into the Rural Youth Engagement Toolkit. So the Grange strengthens individuals, families, and communities through grassroots action, service, education, advocacy, and agriculture awareness. So the Grange is a family community organization with its roots in agriculture. Founded in 1867, the Grange was formed as a national organization with a local focus. Our members are given the opportunity to learn and grow to their full potential as citizens and leaders. With content contributions from the Stand Coalition of Scott County, Tennessee, and the Rural Youth Advisory Council, composed of rural youth throughout America who care about positive community change. So in order to assure sustainability and long-term viability of prevention efforts, youth must play a key role in strategies and policy goals related to substance use and misuse prevention. Youth represent the future, and they offer unique perspectives on how certain drugs impact their communities. These perspectives, ideas, and energy are imperative to cause a generational disruption in substance misuse in rural America and increase the safety and health of communities. Really like this statement because it really defines how important it is, and in this context within rural communities. Okay, so we're going to break down this toolkit going through the slides. So this was created for Grangers, young people, coalitions, community serving organizations, religious organizations, and any other group that seeks to meaningfully engage rural youth to address substance misuse issues in their communities and achieve positive community change through comprehensive strategies with a focus on policy and advocacy. So now we're going to break down the three main structural components of this toolkit. Okay, so the first part is discussing protective and risk factors that exist for rural youth and how to meaningfully engage them in the community change process. So I'm going to go through each of these with a little more information on them. But again, I think reflecting back on my time and my role now, it's important to point out different mistakes made with trying to engage with youth. So engaging youth in projects that have no purpose or end goal is akin to running in place. It gets your blood pumping, but ultimately you finish where you started. There must be a goal in sight, and progress towards that goal must be measurable. Boredom sets in quickly if there is no sense of accomplishment. So thinking about this, especially right now during a pandemic, like what's the buy-in for your youth to be involved in something if it's going to feel like they're going in circles and nothing's coming out of it? It needs to be something where, again, youth are focused in the moment, thinking about ways that you're able to show this is how you make progress and this is how we're going to point out these different steps that's going to lead us to our goal. So breaking it down so that there are smaller achievable goals that youth can feel that make them want to continue to participate. All right, number 2, shielding youth from hard truths. So many of the problems communities face are uncomfortable subjects, even among adults. Isn't that the truth? Sugarcoating the truth is often seen as deceit or insincerity. Many youth live with the realities of these uncomfortable subjects every day. By downplaying the significance of serious issues, you risk losing credibility. Again, transparency is so important. And in my work with youth, they can always tell when you're not being straight with them. And I think that's something that can be really damaging to your relationship. So being able to be thoughtful about how you're presenting things and not feeling like you're protecting them from things that's part of their everyday lives within their communities and within their personal lives. Number 3, using youth for optics. So don't use youth as show ponies. They'll quickly feel like prop if participation is limited to photo ops or delivering adults prepared speeches. Engagement is about inclusion. So thinking about this and how it can feel incredibly uncomfortable to be in a situation where you're allowing youth to take the stage and speak about what's important to them. Like, for example, the Youth Advisory Board, in order to get on that board, each individual who was interested in participating in the advisory board had to go in front of a group of their peers and give a speech about why it is that they feel they have the They have the ability to be in that role and why people should vote for them. And I can just speak from my own experience, wondering what some people were going to say or how it's going to be perceived is really nerve-wracking. But again, that's where it happens. That's where the magic happens. It's youth-led, and it's important for youth to have their voices heard as opposed to us being ghostwriters to speeches for youth that really wouldn't set well. So just an important thing to remind yourself that it can feel uncomfortable when you're letting youth take the lead on things, but it's also very important. Number 4, recruiting to type. So the tendency to recruit overachievers and those more popular in order to recruit their friends, but more important, to be culturally competent. Otherwise, you lose out on the strength of diverse points of view and youth being exposed to points of views they wouldn't experience. So thinking about the work that we do, you know, there are clients that for the Youth Advisory Board, I thought would be really great assets to the team and would really show great strength and leadership. And also there are some that maybe didn't stand out as much to me, but then they're in the role and I'm really blown away by their ability to advocate for their peers and share their thoughts on what it is that's important to them. So I think that when we're considering how to engage youth, it can be really easy to want to just pick the ones that are eager, motivated, doing really well. But if we're thinking about long-lasting change, we really need to consider those that are least likely to engage and trying to join with them so that we can figure out what would need to be different for them to have buy-in in services and groups or what have you. So it's not always about just getting whoever will sign up, but really being intentional about how to engage people who typically wouldn't engage in order to have their feedback and make services more presentable for youth. Number 5, giving youth the facts instead of teaching them to research facts on their own. Oh, this is one I think we've all been caught in, where we're trying to share our wisdom, our knowledge, our experience, but rather missing out on this opportunity to have youth come to that conclusion on their own. So while it would be really easy for us to give youth facts on a subject, such as how policies change, how services are provided based on insurances, challenging them with the task of collecting data and presenting their findings, or doing research online to find out about things that they're really interested in and how they might go about having that happen. Number 6, controlling the agenda. So a popular catchphrase among organizations that actively engage youth is youth-led, adult-guided. A common mistake is planning activities, setting coalition tasks, recruiting members, organizing meetings, and determining discussion items without ever seeking input from youth coalition members. Again, youth are not there just for a photo to say, here we have youth involved, but really we're running the show and deciding what information is presented, but rather taking the approach like the Youth and Young Adult Advisory Board does at Threshold, and having youth create an agenda, follow-up items, decide who's going to follow up on what, and be able to have youth make decisions that support the coalition or the group. So again, we have to relinquish some idea of control and power in order to allow the youth to pick that up. And our job in that moment is to sit with our own discomfort. So you pull out the Calm app, you find something to really just know that this is really important, and long-term, the outcome's going to be so much better and more meaningful for youth, your agency, and the community, that we really need to work on taking a step back so youth can lead without us feeling like we have to control what's happening all the time. Number 7, not being available to address concerns. So what would not be helpful is if you really amp up this coalition, this idea of youth being able to say what they need to say, take these steps, and then when they ask you something about, oh, who should I email about this, or what needs to be done, or when is this meeting, and you're not there. So youth need to know that you're there to support their efforts and that what they are doing is important. So it's incredibly important to be present because youth are taking a risk by engaging with us in creating these changes. They're being really vulnerable, and for us to encourage them to be a part of this, but then drop the ball and not be available is a disservice to them. And again, that's where we lose our credibility with youth. Or then youth say, well, that was a great idea, but Ashley really wasn't there and I was struggling, and I really don't want to put myself in that position again. So by word of mouth, by not being present, it can really have ripple effects. And so something to really be cognizant of. Okay. So on this next slide, as we go through youth engagement tips, I want you all to respond in the chat about something like one of these 12 tips that you are going to really focus on doing or feel like you're doing really well right now. So again, I'm going to advocate that this is the best practice for all youth, not just rural youth, but go ahead and put in the chat the number of the ones that speaks to you as far as something you're really going to focus on or something that you're doing really well. And I'm going to go ahead and read through those and then see what the majority is. So number 1, listen, listen, listen. Number 2, treat them with respect. Number 3, learn what is motivating youth. Number 4, use their communication sources and include them in our communication sources. Number 5, approach them at multiple stages. Number 6, guide and educate them. Do not lead and tell them what to do. Isn't that the truth? No one likes to be told what to do, but especially when youth are trying to emerge into adulthood and make these decisions, no one wants to hear that. Number 7, allow youth to plan their own strategies and facilitate their own implementation plans. Number 8, go to youth where they are now. So one of the cool things about my program is that this idea of really meeting youth where they're at and making things such as therapy, case management, and support more accessible. Sometimes we meet them in the community and go for a walk, or we'll go to a coffee shop. With COVID, it's made things more challenging, but this idea of meeting youth where they're at instead of telling them to come into this office where I'm at because it's comfortable for me, but for them, they'd have to take public transportation, get there, and it's really a hassle. Number 9, form a strong relationship with youth serving entities such as schools, churches, etc. Number 10, don't try to have all the answers. Ooh, yes, this is super important. I think sometimes when we get anxious about something, or let's say if we're working with a family or a difficult person, we might want to have this presentation that we are the professional, we know all the things, but with youth, it's so important to be open and say, you know what, I don't really know, and I'm happy to work through it with you. And it's okay that I don't know because I don't know all the things, but I'm happy to be with you in this moment and work through it together. Number 11, make it exciting and fun. Number 12, know and understand pop culture. I've had many clients I work with that I ask them what kind of music they like, what do they listen to, and I'll pull that up in session and talk through why they like it, or point out things I like about it, or what my interests are. We're being our authentic selves, and that goes a long way with youth, because youth don't want to just be with a cookie cutter adult who just says things that are right or always the adult's thing to say, but rather we're humans. We share similar interests, and I always find it funny when I'm doing an activity or talking about music, and then I share a song I like, and a client will look at me like, you know that person? So I always feel a little good when we're able to name the areas where we have that shared common ground. All right, I see the chat is really popping up. Karina, would you mind helping me go through some of the things people have pointed out as general themes?
Sure. Listening, respect, do not lead and tell what to do already doing. Struggling with knowing and understanding pop culture. So let's see, 6 and 10 and 1 are popular. 8 is harder only because our girls are all over 2 countries, but we do have company van transportation for our girls to attend. Virtual will help with access for now. Number 6, services and goals must be youth-driven, and some people like to use 2 and 5 all the time. I want to do better with 11, and I really need to amp up 12. And then some other ones are 1, 2, 3, 6, 8, 10, and 11, 4, 7, and 9. Our students love to play Kahoot during a training. It snags them and keeps them engaged. And I can agree because I used to be a school teacher, so teenagers love that. 3, 7, and 9, 10, and then 11 seems essential. 7 and 8 are very effective, and 12 is a challenge. 3 and 7, our team of specialists are currently working on a youth leadership summit. All engagement tips are wonderful. I believe that numbers 3 and 7 would make for a successful summit. I feel I listen well, but I need to work on learning what is motivating the youth. What we need is guiding and educating the youth to plan their own strategies and facilitate their own implementation plans. Someone agreed meeting them where they are. Again, listening, respect, and use of communication. Extremely important to earn respect. Doing good with 6, but not so good with 12. 12 seems to be a challenge for a lot. For example, we are good at helping to enforce and educate regarding tobacco use laws, but we never ask or understand why youth are vaping.
Wow. Lots of helpful feedback there, and I also hope that as people are seeing the chat and Karina is reading through the responses, that we all have different things that maybe we naturally gravitate towards doing that makes it easy for us to connect or engage with youth, but that there are always other things we can strategize and use to help reinforce that and build upon it. So if knowing and understanding pop culture is difficult, maybe that's when you take time first thing Monday morning and try to get caught up to speed on what's going on Snapchat? Why are all the people talking about different celebrities or things that happened? And being super intentional about creating your own homework. I always like to give clients the opportunity to assign me homework. If it's something where I'm asking them to do, I'll either do the same thing with them or ask them, what's something that would be helpful for me to learn about that's important to you? And then I will go back and do that before our next session. And they're typically very surprised when I actually go through and do it. I think that's the biggest part. Don't say you're going to do something if you have no intention of doing it, but really this idea of like they're learning about something new or a different approach, and it's up to us to also be open to learning about how this thing or this interest in particular is important to clients, and how we're taking a personal investment in it, and we're saying, you know what, what's important to you is important to me, and I'm willing to go ahead and learn about it myself so I can better be there with you and know why it is that this artist is so important to you, or why is it that you pay a lot of attention to Snapchat, what's going on. So I think that seeing these things, bringing it back to teams, coworkers can be really helpful. And if you're getting stuck with a youth, maybe think about them in particular and name the different ones you're doing really well with them, and then the ones that, like the numbers of engagement tips that you might be struggling with for them. All right. Thanks everyone for participating. It's really helpful to hear other people's ideas and what it is that people are doing well, or that people may have areas to kind of enhance and build upon. Okay. All right, so the part 2 of this toolkit talks about 7 strategies typically used by coalitions to change individual behaviors and community conditions. These are commonly referred to as CADCA's 7 strategies for community change. These strategies include provide information, build skills, provide social support, reduce barriers / enhance access, change consequences and incentives, alter the physical design of the environment, and change policy and rules. So section 3, policy and advocacy, is a guide for youth and organizations on how to systematically analyze and take specific actions through advocacy to achieve policy change to create safer and healthier communities. So this is the part of the toolkit that will discuss how to actively engage rural youth in advocacy and how to differentiate between grassroots advocacy and lobbying. So this is something I contemplated going to the website about and showing you through the toolkit, but I feel like we've had a great chance to go through other areas of engagement and working with youth, and I really would love to move forward and go to our next slide where we reflect and wrap up for our time together, because you all have been an amazing bunch, and I would love to get some responses to this. So as we wrap up for today, I want you all to think about the following. What's the most important thing you learned today? What's one thing you plan to implement? And what's something you're already doing well? So take a moment, respond to the chat. Any answer is great. Let's just reflect collectively on our time together and the areas that we're going to take with us. And also point out those areas that we are doing really well when it's listening, meeting clients where they're at. Because I think in this field, it's really easy to focus on where we have areas of growth and change, but also we're doing a lot of really great work, and that should be acknowledged as well.
Okay, we have some comments coming in, utilizing more digital resources to use with teens. The refresher of meeting kids where they are at is always welcome. The importance of including the youth culture and having interest in it. Trying to meet the youth where they are at, but by not only listening to them, but always trying to be an example. All the resources to pass along to our community partners. We're doing well with meeting teens where they are and identifying with them without judgment. I'm looking forward to, okay, someone wants to check out your resources, so that was their comment. Doing well.
Oh, awesome.
But want to work on utilizing additional resources. And then the digital section, specifically all the different resources that are available to youth and their families. And they said they were going to be putting that on their website and on social media.
Awesome.
One more most important takeaway was learning about share recovery and resources shared, the various tools available to connect with youth digitally, let go of being in total control and allow youth to express their ideas and thoughts. I easily engage with my youth and their culture. I frequently ask them to share music and lyrics. That's a good one. Exposure to resources, greater collaboration, being non-judgmental. And I've learned a lot about the Smart Recovery resource and plan to implement that with my clients, already building relationships with teams that we serve really well. And then just an increased awareness of developing future leaders and creating a healthier community. Importance of giving youth more control. And someone said, I really need to do more homework, using more resources and letting youth know that I care about them. I think the common mistake was very important to know that information will assist us in checking ourselves and making sure we are doing what is best and most empowering for the youth. Listen better and let them take a more active role, reflecting on the idea that sometimes we feel so pressured by the time to get an event done and measured that we forget the importance on giving the youth greater responsibilities. Talk to teams more about resources and listening and not trying to tell them what to do. That was, again, said. Something we do well is train our teams to use the SPF to develop and implement strategies on their cameras, I think. How to keep youth engaged is the most important thing that I learned today. And moving forward, our substance use team will be sure to listen to youth members of the community in order to gain their perspective and insights. We'll take full advantage of the resources shared, instantly implement the LeBron James meditation. I have a lot of youth that would engage with that one.
Yes, that's really important.
Implement the virtual resources and digital resources. And it was affirming to see how our group of my fellow therapists are developing and aligns with what our goals are for our teen girls and discussing social action. Everyone loves the resources and looks like there's a lot here that plans on implementing that with their group and adding links to their website. Again, it's good to know things like SMART are available. And I got a better understanding of the public health view and the coalition view. Again, respecting youth and staying up with pop culture, the challenges particularly for rural youth using their communication sources. And it looks like there's just a lot of the same comments. Show that we care. And then online resources during COVID and beyond is very helpful.
Awesome. Thank you all for your thoughtful feedback. And the LeBron James meditation, I also think, too, about how you can reinforce how he's used that to help win a championship. So really good timing with that one. So as we wrap up, I'll go to my final slide to take a moment to say thank you for all that you do. You know, you agreed to meet in the morning, listen and learn, and also have tangible things to take back with you. And the fact that you're open and willing to share these resources really speaks to your commitment and dedication to the people that you serve. And so I'd like to just really thank you for your time this morning. Thank you to Karina and Eric for all of your support, for FATA, and just for this opportunity to share resources during this difficult time. So with the presentation, there's a resource page and reference guide. Feel free to use. And if you have any questions, feel free to reach out to me at my email address. But thank you so much for your time. You all have been a wonderful group.
And Ashley, we'd like to thank you as well. You did an awesome job. I think you did well with answering questions as they came along, and we have a lot of great feedback regarding the resources that you've shared. So, and we also want to thank our audience for joining today. And I wanted to let you know that when we conclude today's webinar, your browser is going to take you to an evaluation on FADA's new website. If you want to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation, and you can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in our FADA system. So this helps connect your attendance and your profile. So it's important that you use the same email address with your profile that you used today so that we can connect it to your attendance. After you register or sign in, again, you'll be directed to the evaluation. You will get a second opportunity to complete the evaluation through a follow-up email that you should receive as soon as the webinar is over, and it'll be from Messenger at WebEx. Again, remember, the evaluation does close at midnight on Friday, October 23rd. And so once you've completed the evaluation, we do start processing those credits. We do not email statements of credit. Instead, or after we verify your attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. So again, the evaluation closes this Friday at midnight. It does take up to 30 days to post your credits. You will get a email just saying thank you for submitting. And let's see, within the 30 days, you can go ahead and check your profile under contents and features and professional development so that you can print out your statement of credit. And that's how, once the attendance and evaluation is verified. So that's pretty much it. I just, again, want to thank you for participating in today's webinar, and thank you again, Ashley. We'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold on for the evaluation. Thanks, Ashley.